Cindy asks, several friends and I are looking for ways to reverse osteoporosis. I'd like to learn more on how to reverse this. It's something no one is trying to help many of us with. Thanks. What a great question, Cindy. And thank you so much for writing in about a very, very common diagnosis for both men and women. One of the things that I want to really dig into and drive into today is that osteoporosis is very much driven, the heart of it is hormonal imbalances. What we see when we go through the pause, andropause for men and menopause for women, is that we have a reduction in hormones that keep our bones healthy. And not to get so into the weeds in terms of the different structures and the synthesis of hormones, but essentially what happens is in women particularly, our decrease in estrogen yields a lessening of the remineralization of our bones. And so at the core of reversing osteoporosis or osteopenia, the kind of beginning of the osteoporosis, is the requirement to balance your hormones. For women, we need to look at increasing our estrogen levels. And this isn't necessarily about going with hormone replacement therapies, but there are natural products and natural supplements and natural herbs that we can add into our daily lives that will naturally invigorate and enhance our estrogen levels. One of my favorites is a maca. It's called maca. Maca is an herb out of Peru, and it is very pro-estrogen balancing for women and men. The other thing that I recommend is consuming natural, non-GMO soy products. So you might find some imported soy out of Japan that is fantastic for enhancing your estrogen levels. And then most critically is balancing the cortisol levels. Cortisol management, cortisol is our stress hormone. Cortisol management is an underlying factor that can convert, when triggered, it converts our estrogen in women into testosterone. And it can also cause the leaching of progesterone. So at the core of a lot of hormonal imbalances are cortisol mismanagement or cortisol imbalance within the body. So managing your cortisol levels becomes really critical. So the question is, how do we do that? Well, one of the things that I love to recommend, particularly here at Organixx, the 7M Plus has adaptogenic herbs that help support and balance the cortisol levels naturally in your body. So if you're seeking to balance your hormones because of maybe undergoing perimenopause or menopause or andropause, 7M Plus would be a great supplement to grab to do that. Now, a core, really the most important nutrient necessary, a core building block to your bones remineralizing is going to be vitamin D3. And vitamin D3 is something that a lot of physicians are aware of the research, but they're not communicating this readily. And we're also not seeing testing happening. So it's really critical for you to analyze, get a lab, a blood draw, and find out where your vitamin D3 levels are. In some cases where we see the supplementation of the turmeric 3D, you're going to find there's usually 5,000 IUs in your label. So you'll see a single dose includes 5,000 IUs. For some individuals, their vitamin D levels are so low, they need 3 and 5 times that dosage. So you'll find the varying of the dosage requirement daily could range from 5,000 IUs all the way up to 50,000 IUs. And those are safe recommendations. We know that vitamin D is not a vitamin. It's actually a steroid. It's a hormone. It's a compound that every cell in your body needs. It's a requirement for remineralizing our bones, as well as supporting our immune health and basically energizing every single cell in your body, as every single cell has receptivity to vitamin D3. So if you have really low levels of vitamin D3, sometimes turning those levels up to an optimal state can take 6 months, 9 months, sometimes a year even. So that's really critical in terms of knowing that reversing osteoporosis or reversing osteopenia is not going to happen overnight, but with time, with choosing really great quality supplementation, fermented, and maximizing bioavailability will be critical in harnessing the potency of your vitamin D3 in your own body. Now, coupling up vitamin D3 Another building block, or a multitude of building blocks we need, are going to be minerals. So I recommend individuals consume multi-minerals, where they are drinking mineral water and they're consuming rooted vegetables that are dense in minerals, as well as adding a mineral supplement to your diet, because we need magnesium and we also need zinc and we need iodine. It's not just calcium, that's that core necessary building block, but we need the balance of those. And in some cases, I have patients where we do testing even further to evaluate just the ratios between some of those values, where we also need to have the ratios balanced. But those are going to be my top recommendations for addressing osteopenia and osteoporosis and reversing the lack of remineralization or the bone loss. It is absolutely possible. I want everybody to know, the takeaway here, Cindy, is that your body is constantly rejuvenating and regenerating. And our bones, regardless of our age and if we're cycling or not, our bones are constantly rejuvenating. And so as long as you give your body the right building blocks, it'll do what it needs to do and remineralize. One other little tip here is to add in weight-bearing exercises. So weights versus cardio is going to be most important for straining the bones. It actually is kind of like a micro trauma that we want to occur. We want the bones to establish the need for the minerals and the vitamin D3 that you are giving your body. And it triggers the whole growth factors, and it actually helps to remineralize those bones, create denser bones. This is really important when we're looking at as we age. We want strong hip bones, we want strong leg bones, we want all of our extremities and internal bone structure to be strong and supple. So those are my tips for you. Let me know if you have any further questions.